Many times in jiu-jitsu, we chalk up breathlessness to being deconditioned. Man, I'm out of shape. There are several common respiratory tract conditions that can definitely impair performance. A very common one is an acute upper respiratory tract infection. An upper respiratory tract infection is an infection above the vocal cords, either viral or bacterial. Common symptoms would be facial pain, sinus pain, front nasal drip, postnasal drip, congestion, coughing, etc. A second very common condition would be a lower respiratory tract infection. This is an infection below the vocal cords, productive cough, dry cough, congestion, etc. Another common condition is uncontrolled allergic rhinitis, allergies, pollens and molds landing on the lining of the nose, sinuses causing chronic congestion. You can suffer from postnasal drip, front nasal drip, congestion, feeling of breathlessness, etc. Another common condition is exercise-induced bronchospasm. This is where the tubes in the lungs go into spasm during or shortly after exercise. This is a little different from exercise-induced asthma, which also has an inflammatory component to it. But exercise-induced bronchospasm can be a common cause of impaired performance in jiu-jitsu. Another common one is exercise-induced asthma, where during exercise the lung tubes go into spasm and there's a chronic inflammatory component in the lining of the lungs also. A less common one is exercise-induced laryngeal obstruction or vocal cord dysfunction. The vocal cords open and close to allow for breathing, speaking, etc. In some people during exercise, these vocal cords can work asymmetrically or not perfectly with the rest of the body, causing impaired breathing and a feeling of breathlessness. A less common condition would be an acute pneumothorax. A pneumothorax is where one lung collapses or deflates to some degree. This can happen suddenly, where the athlete suddenly feels short of breath and knows something is wrong. Or, in a well-conditioned athlete, the symptoms may be much more mild. It is very important, if you're suffering from breathlessness or trouble breathing during exercise, to not chalk it up to just deconditioning. Please see your doctor for a full physical exam with full labs. It could be deconditioning, but it could be something related to the lungs, the heart, uncontrolled blood pressure, anemia, slow thyroid function. The differential diagnosis is huge. However, there are excellent treatment plans for all these chronic conditions so that your performance will not be impaired due to this.